Hello, everybody. My name is Paul Cambio. I'm one of the co-chairs of the California Lawyers Association Health and Wellness Committee. It's our pleasure to bring programs about health and wellness to attorneys who sometimes don't take the time themselves to research important things to improve their life. And we are very, very lucky to have Dr. Peter Rogers, MD, with us today. Dr. Rogers is known for having the best theories for cognitive decline, supply and demand theory of neurodegeneration, back pain, toxicology theory of spine degeneration, the role of mitochondrial inhibitors in disease. Dr. Rogers went to Stanford University, where he was the student athlete of the year, wrestling team captain, and set a school record for most wins in a season at 39. At med school, he went to the University of Illinois, graduated first in a class of 333 students with 99% board scores. His residency was at Northwestern. Again, he had 99% board scores. He had a fellowship at Harvard for imaging guided surgery, a second fellowship at Russian University for neurology. He's the author of 20 books, including having rewritten the textbooks on internal medicine and neurology. Book titles include Medical Reform, Mood, Food, Mood, and IQ, How to Improve Blood Flow. And you can see him on his YouTube channel, Peter Rogers, MD. And without any further ado, I'll turn things over to Dr. Rogers. Thank you for being here.
Thanks, my pleasure. Hey, would you like me to start my talk?
Yes, please start your talk.
Okay. Okay, we're going to start out here. A lot of you have probably seen the movie Christmas Carol, written by Charles Dickens. And, there's a cover, there's Bob Cratchit with Tiny Tim. And today, I am the ghost of Christmas future, and you are Scrooge. I am going to show you the future of your health if you continue with your ways. Okay. Basically, you are here on the map. And what the typical American person does is they eat a Western diet, which is a real high-fat diet, typically the SAD diet, standard American diet, or they eat some version of the Mediterranean diet. The Mediterranean diet, by the way, is a joke. I'll explain why in a moment. And these high-fat foods and the other chemicals in these foods lead them to become overweight, hypertensive, and diabetic. And that then leads to atherosclerosis. They plug up their arteries. They go to a conventional doctor, and he treats them with drugs. Drug. The drugs don't work so well. Then they go for surgery. Chop, chop, chop. Bye-bye money. Dead prematurely, around 70, a little more or less. Okay, and what I'm going to show you is there's only one way to escape this. I've been a doctor over 30 years. I studied this in great detail. The only way to escape is to have the best odds of escaping this painful way to go is to eat a low-fat vegan diet and avoid certain toxins that we're going to talk about. I'm 61. I have no medical problems. I don't take any pills. Okay. Now, here is the same story in a little bit more detail. These are all the real common problems with the diet. We're going to talk about the problems of fat. Animal protein intrinsically is not good for health. Okay, it's a burden on the kidneys. It activates mTOR, the growth pathway, and it accelerates aging. Okay, the dietary sodium is a vasoconstrictor, clamps down on your arteries. Iron is like fire in the house. You want a fire in the stove to cook your food. You want a fire in the furnace, to heat your house, but you don't want fire anywhere else. And what happens is people eating Western diets become iron overloaded, and they start having all these secondary chemical reactions called ferrous redox cycling that leads to something called the Fenton reaction, and it damages a lot of tissue. So most Americans, men by the time they're about 25 and older, women after they're postmenopausal, 55 and older, they tend to become iron overloaded, and that's going to cause a lot of health problems, okay? Processed food is full of toxic chemicals. They always are going to have mold inhibitors in there, which tend to be mitochondrial inhibitors. Your mitochondria are what produce your energy. You don't want mitochondrial inhibitors. And there's a lot of other ones. We're going to come to that in a little bit. You want to filter your water. Tap water is full of bad chemicals, not the least of which, fluoride and, the aluminum, and there's all these estrogenic chemicals. Coffee and tea, caffeine is not good for the brain. We're going to explain why. Tea also has caffeine in it. It tends to concentrate some other chemicals you don't want, like aluminum. Aluminum is also a neurotoxin. Soda pop, bad. Dairy, bad. Dairy strongly associated not only with atherosclerosis, prostate cancer, but also a lot of autoimmune diseases. And of course, excessive psychological stress, sleep deprivation, caffeine do pretty much the same thing as excessive psychological stress. Also, a person should have a sense of purpose, because when you have a strong sense of purpose, it makes you more resilient. People that follow any of the major religions tend to be significantly healthier, perhaps because it helps them find their sense of purpose, perhaps because it helps to lower their stress, but that is a fact. Harold Koenig has written books about that, done a lot of research on that. And divorce, a lot of people go through difficult times, like with divorce and whatnot, and that can be psychologically stressful. So you have to have good things in your life that help to counterbalance the problems and make you more resilient. And being sedentary, you got to move. You got to move, use your body, use it or lose it. Okay, so anyways, the point is that all of this stuff leads to the same disease. Almost all the patients have the same disease. If the resident's calling me to go over and do a procedure and they tell me the patient's, 60 years old, I don't even need to look in the chart. I automatically know that patient will probably be overweight. Not always overweight, but they'll probably be overweight. I can tell you they virtually always are hypertensive. They virtually always are pre-diabetic or diabetic, okay? And then those things cause atherosclerosis, plugs up artery in the heart, coronary artery disease, which leads to atrial fibrillation, congestive heart failure, myocardial infarction, cardiac angina. They also have atherosclerosis to the Johnson, leads to impotence. And then all the major eye diseases causing blindness, they're all vascular diseases, cataracts, diabetic retinopathy, age-related macular degeneration, hypertensive retinopathy, glaucoma. Okay, they're all variations on a theme like a Bach fugue. Okay, spinal degeneration comes along with this. So they feel their spine's not getting enough oxygen or glucose, and their spine progressively becomes scarred off, degenerative disc disease, and it becomes weaker. And, I'll go into that later. Coronary artery disease, peripheral arterial disease. Okay, so anyways, they all have the same disease. And so the sad thing is they all have the same disease. Most of them are sick. Most Americans, by the time they're 55 to 60, they're fat, sick, and cognitively slow. Okay, but it doesn't have to be that way. All right, and like I said, conventional system, just drug. Match the ill to the pill and send a bill, okay? Then you can't cure a dietary disease or a toxin disease with a pill. You just can't. So they never cure the patient, and the patients tend to deteriorate, and then they go for surgeries, and the surgeries don't work too well either. And they end up, all this stuff. Stents and CABGs don't increase lifespan of the patient. Cataract surgery. Whenever I see a demented brain MRI, a brain CT, almost always these demented patients have one or two cataract surgeries and poor dentition and a really shrunken atrophic brain. And what does this all lead to? Pain, poverty, misery, lots of hassles, going to the pharmacy all the time, doctor appointments, poor cognitive function, early death. Okay, so here's the same thing, just in a little more detail, pretty much a summary of what I said. And I would also say the right path is sort of what we're designed for, Genesis, live like Adam and Eve, but keep your indoor heating and plumbing. That's God's way. It's free and it works. Okay, you have to buy food anyways. Might as well buy good food. Man's way of giving all your money to the doctor and the healthcare system is expensive, it's painful, and it doesn't work so well. Here's some life curves. Typical Americans eating something like some version of the standard American diet called the SAD diet, and they're usually starting to get fat and sick by the time they're in their late 40s, okay? And they'll often die in their 60s, and they really can't do too much. A lot of them have to quit working, and they can't do certainly a physically challenging job after about 50 years of age quite often, okay? I see a lot of people come to me, friends of my kids' friends, their dads ate this type of diet, and they just, they have to check out from whatever their job was that was physically demanding. Okay, like being a carpenter or being a mechanic or something. Okay, Mediterranean diet, it's a little bit better, but the Mediterranean diet is really kind of a big fake out. It avoids processed food to some extent, but it still allows most things. It allows oil, it allows meat, it allows alcohol. Okay, now here's a low-fat vegan route. You got a good chance on this route to make it to about 90, okay, if you really follow it tight. And you probably won't be getting debilitated until you're after 80, and you'll be keeping your smarts a lot longer. So when you die, that's your lifespan. When you start becoming debilitated, that's your health span. So you want to have as long a health span as you can. Enjoy your life, okay? It's enjoyable to be healthy. People sometimes say to me at a party, a wedding or something, oh, why don't you have some cake and pizza and all this stuff? Don't you want to enjoy life? And I'm thinking to myself, being fat and sick is not going to help me enjoy life. Okay. The other thing, too, I was going to tell you, well, first of all, here's a quote from Revelations 18:23. For thy merchants were the powerful men of the earth, and by their sorceries were men deceived. The other word for sorcery is pharmakia, pharmacology. The average chump, in my experience, they think that the drugs are real and the surgeries are real. And they think that all this stuff about plant-based diet is fake. The opposite is true. Okay, here's a painting related to the Odyssey from the ancient Greeks. Circe was the witch on the island, and the men of Odysseus drank her potion, and they were turned into swine. Okay, and the reason I'm showing that is that's what happens to the patient, except they get turned into cows. They get turned into a cash cow that the medical system milks every day because they have to take a pill every day. It's pretty common for patients over 60 to be on at least 5 pills, very often 10 or even 15. All day long, every day, I see that. Okay, so every day the patient's got to buy pills, got to keep on going back for follow-up appointments, get their labs checked, okay? And so I even have called the Mediterranean diet the Antichrist diet because it pretends to help patients to save their health, but it actually makes them sick. It doesn't work because it doesn't forbid anything. Like I said, oil, meat, dairy, nuts, all these high-fat foods and alcohol and caffeine, those are not good for people. And where most people find themselves as they get older in a Western country is in what I would call the pit of doom with progressively worsening chronic diseases that we just spoke about. And they go to the doctor, please save me, help me. You know, this is a good doctor. And the doctor, what's he going to do? He's going to throw them a lifeline made out of drugs that don't work. They're not going to get out of the pit of doom. It doesn't work. And it's always raining, and they always got a new sad story because their health just deteriorates. You don't get better. I call it the medical idiocracy. Okay, the person who's with it enough to recognize the problem, the smart pro, can say, you know what, screw this. I'm going to try to learn how to help myself. I'm going to learn about diet. I'm going to quit the toxic things, the alcohol, the tobacco, all that stuff. I'll start up a reasonable, gradually increasing exercise program. I'll get my sunshine for vitamin D. I'll have a sense of purpose in my life, whatever that might be, to help your kids, to help your customers, to help your athletes if you're a coach, your students if you're a teacher, whatever it might be. But that sense of purpose, I'm doing something useful and good, that energizes a person, releases reward neurotransmitters in their brain, lowers their stress level, and gets their immune system to function better. Your immune system heals everything. So you want your immune system working well. And I'll tell you this, my doctor buddies will tell me, if only the patients realize that they have all the power. All we've got is a bunch of drugs that don't work. They're the ones that can choose what they eat, whether they get their sleep, how they manage their stress, their psychology. Okay, the patient's the one with the power. And this is the divided by attitude, who will suffer, which is the vast majority of people do not age well. And the few that do tend, some people just get lucky, but most of the ones that do, they get their act together. So like I said, it's like Genesis, You live like Adam and Eve, but keep your indoor heating and plumbing. Genesis 1:29. Then God said, behold, I have given you every plant which is upon the face of all the earth, and every tree which has fruit. It shall be food for you. We're designed to eat these plant foods. We got flat teeth. Our teeth are flat like a herbivore. Take a look at a horse's teeth. It looks like yours, okay? Our jaw can go side to side because it's made to grind plant foods. And all you got to do is ask yourself, okay? If you are walking down a path in the forest, okay, and you see a dead deer, a carcass, and the flies are buzzing over it, do you want to get down on your knees and take a bite out of it? You don't even have teeth big enough to pierce its hide, okay? On the other hand, if I put a bowl of fruit out in front of you, you'd salivate. You're made for that. I think that's why we have color vision, so we can see when fruits are ripe. Okay, so anyways, then the next thing a lot of people tell me, well, my uncle, he drank, he smoked, he slept with hookers, and he lived to 90. You don't need all this vegetarian stuff. And I would tell you, look, you could have 100 blind men cross a busy street, and some of them will get across, but that doesn't mean it's a good idea, okay? You want to do what gives you the best possible odds, all right? I've been doing this for a long time, and I can tell you, I wish there was some other easy answer, some magic pill or something. I'm not aware of anything. I've searched hard. If there was something, I would do it. I'm 61. I want to be as healthy and fit and cognitively sharp as I can be. I do everything I can to optimize that, and I can tell you, I'm not aware of anything else than what I'm telling you, okay? All right, so I was going to say, so a lot of people, they're going to maybe challenge me. I'm saying, go ahead. Start looking around. You'll find what I'm saying is true. I've researched this backwards, forwards, ups and downs. I've spoke with the best experts in the world, gone through all the books, all the video sites I could find. And I just do this for a hobby because I know this is the most powerful thing in all of medicine, okay? I don't get paid for this at all. I don't monetize my channel. I don't sell anything. I want to be the best doctor in the world, and I have to do this because this is where it's at, okay? Here is Cassandra. She was the prophetess of Troy, and no one would listen to her. She had been given the power of prophecy by Apollo, But no one would listen to her. She said to Paris, stay away from Helen. It'll lead to the destruction of Troy. Even later, she told them, don't bring in the Trojan horse. It'll lead to destruction of Troy. So here is a Trojan horse, the painting here, that was brought in inside the gates of Troy. And then the Greek soldiers came out of it at night and they sacked Troy. And what I'm getting at is people think all this processed food and restaurant food is so wonderful because it tastes great. They don't understand. It's filled with lots of chemicals to make it hyper palatable. It is not good for your health at all. They'll do research. These companies are real smart. They got billion-dollar budgets, and they bring in all these test subjects, and they put just the right amount of MSG and MSG, monosodium glutamate, manufactured free glutamate, which is like an amino acid that you have taste receptors for, because our ancestors were worried about starvation. So for them to get a good protein source was difficult to find, and reward neurotransmitters go to the brain with that. You can make stale food taste fresh by throwing this stuff on there. Okay. Salt tastes good because it's relatively scarce in the natural environment of our ancestors. Okay. They have chemicals in there to give it just the right mouth texture and feel. They put high fructose corn syrup in there, just the amount of fat. So it all is real pleasant until they reach what is called the bliss point, the ultimate in hyperpalatability, where the audience wants to keep eating it. Okay. These research studies. So what manufactured free glutamate is all about is you can take a baseline protein with the individual amino acids. That's what a protein is. It's like a string of amino acids, like a string of pearls on a necklace. And you can break off, the G stands for glutamate, and you can individually separate out the glutamate. So now they're free. So it was a manufacturing process to free up the glutamate. And what that means is when all these glutamates that are freed up, they hit those taste receptors in your mouth and your digestive tract, you get this blissful feeling. Wow, I love the taste of this food. But like I said, it's artificial. It's going to, it's like the Trojan horse. It tricks you into think you're eating something good, but it's really bad for your health. Monosodium glutamate, MFG, they're neurotoxins. They're bad for your brain. And I actually think there's good reason to believe they increase your risk of cancer because they can go through the back door to make glutamine and thus supply Krebs cycle and feed cancer. Okay, now here's the other thing. There's a tendency for people to have too much respect for the official major medical centers, places like Harvard, the other Ivy League places, Mayo Clinic, these UCSF, and these other famous medical centers. And what I'm going to tell you is they're all overrated. And when it comes to chronic disease, they're basically a joke. And I know that sounds like strong words, but I'm going to show you that it's actually obvious. I was just speaking to a medical student a couple weeks ago, and he says to me, you know, is it really correct that 95% of hypertension is idiopathic? Idiopathic means the doctor's an idiot and the patient's pathetic. It means the cause is unknown. Essential hypertension is also caused. That is what they still teach patients to this day. Just what I was taught many years ago when I was in medical school. Gosh, it was, I don't know how many years ago, about 40 years ago, something like that. Okay, so anyways, this is not true. Okay, they tell the students that nobody knows the cause of disease. You're going to see if you read almost any chapter in a book. This is why I rewrote the internal medicine textbooks, because I kept seeing that in all the chapters on chronic disease. They say the same thing. Well, it's associated with aging. Seems like it's sometimes genetic. Seems like it's sometimes due to an infection. Sometimes it's due to socio and economic disparities. And you go, isn't that thoughtful? Isn't that nice? Oh, it's a bunch of nonsense. Okay, and I'm going to show you why it's a bunch of nonsense. First of all, the point I'm making here is all the Ivy League experts and all the famous medical school experts, they all say the same nonsense, that these diseases are of unknown cause and there's nothing you can do except try to slow them down with a pill. And what I'm saying is they're a bunch of sellouts and liars. Okay, if you went and hung out with these guys in the jungle in South America, Yanomamo, okay, in the Amazon jungle on the border of Venezuela and Brazil, they don't have any hypertension. Why? Because they eat a low-fat, plant-based diet, okay? If you traveled to northern Mexico and hung out with the Tarahumara, that sort of means fleet runners. They're world famous ultra marathon runners. Okay, they live around the Sierra Madre Mountains, Copper Canyon area. They used to be combined with the Pima. The Pima were absorbed into Arizona after the Mexican-American War in 1848, and they now eat primarily a SAD diet. Okay, and here's the difference it makes. The Pima, who eat the American westernized SAD diet, they're fat and sick. Tons of gallbladder surgeries. They get terrible diabetes, end up with amputations, going blind. They get atherosclerosis, they end up going for heart surgery. Cabbage means coronary artery bypass graft. You get all the autoimmune disease, thyroidectomies. From the cardiac disease, they end up getting a cardiac pacemaker. Diverticulosis from the lack of fiber, being constipated. Get diverticulitis, take out the sigmoid colon. They also get increased colon cancer. Appendicitis, when you don't eat fiber, you get a dry stool. Okay, so that's the fate of the standard American diet. That's what it leads to. They got the same genetics as the Tarahumara. These guys are famous. They have a holiday once a year where they run over 100 miles in 2 days, okay? Nathan Pritikin patterned his diet after the Tarahumara because their energy is so incredible. You want to have energy. Energy is what lets you do stuff, okay? And one of the things I wanted to show you was I had read about fat, especially saturated fat, causing inhibition. This is the inner mitochondrial membrane inside your mitochondria. Mitochondria are the little energy factories inside your cell, okay? And so I knew that fat would do that, and I read about one other inhibitor of the inner mitochondrial membrane, and this was years ago, and I'm like, there's got to be more of these. There has to be. I just come across them sort of tangentially through my reading of the literature, and I'm like, there's got to be more. I got to figure this out. So I own about 7 biochemistry books. I was going to consider being a biochemist, and I go through all my biochem books, and there was nothing on mitochondrial inhibition. I'm like, that's weird. That doesn't make sense. And I'm talking about the best biochem books you could buy, all right? And I'm like, there's something wrong with these books. So I started going through all the literature. I quickly found over 50, then 60, then 70 mitochondrial inhibitors. And as it turns out, they're often very common. Okay, you ever heard of Tylenol before? You ever heard of statins for treatment of atherosclerosis and high cholesterol? You ever heard of metformin for treatment of diabetes? These are the most common drugs. And this is what I'm trying to tell you. Many, if not the majority of the most common drug categories, they inhibit the mitochondria. Do you understand how insane this is? Okay? That's like saying, I'll give your car better travel distance by draining the gas tank. That's contradictory. It's stupid. Okay? And it goes on and on. Common drugs, your antipsychotics like Haldol, your selective serotonin reuptake inhibitors, okay? And even your tricyclic antidepressants, both the old and the new classes, Prozac, fluoxetine, okay? Fluoride, by the way, is also a mitochondrial inhibitor. Fluoxetine, what do you think the flu for? It's for fluoride. It's like so many of these, it binds tightly to things and helps them to cross the blood-brain barrier by making them less polar, okay? Cadmium, often seen in processed foods. Atrazine, which is on the GMO corn, okay? Glyphosate, that's on the GMO soy, non-organic corn. There's tons of them, and they're real common. Your fluoroquinolone antibiotics, your beta-lactam penicillin antibiotics, your aminoglycoside antibiotics, your anti-seizure medications, the lipid peroxidation products of cooking oils. I never eat anything with oil, okay, because it leads to production of this thing right here, H&E, hydroxynonenal, mitochondrial inhibitor. So these things suck the energy out of you. And what I'm trying to say is you're never going to reach optimal health by taking a bunch of pills. All of these things poison pathways in your body. You can't poison your way to optimal health, okay? The benefits of these drugs are highly, highly overrated. Processed food, by the way, routinely has antifungals, which is another way of saying anti-mold, and those routinely are mitochondrial inhibitors, okay? Alcohol inhibits some of the pathways in mitochondria, okay? This is all bad. All this stuff is bad. You don't want it, okay? And a lot of people also are saying, oh, you could take cyanocobalamin B12. I don't think so. You know what cyano means? Like cyanide-like, okay? That inhibits inner mitochondrial membrane. I don't like it. Almonds got some of that in them. So does flax. I don't want any of that stuff, okay? Because a lot of people hype those things as being good foods. I don't think so. And they also hype a lot of high-fat foods. I don't think so. The higher the fat you eat, the fatter you get. And the more likely you're going to run into problems with hypertension and diabetes and mitochondrial inhibition. Non-steroidal anti-inflammatory drugs, aspirin. There's a lot of them, okay? And there's even more I couldn't even fit on here, but you get the point. These are common. Beta blockers are on there. Okay, here's a book that I wrote. Ischemic spine is the most common cause of back pain. And this picture on the cover shows you what's going on. Here's the abdominal aorta, runs right in front of the lumbar spine. This means your lower back. Gives off a lumbar artery mid-height on the vertebral body, and it has a little twig branch going up to the upper end plate and down to the lower end plate. So this is the disc, the spinal disc. Here is the vertebral body. 2 vertebral bodies and the intervening disc, that's called a spinal segment. And the point I'm making is that the disc does not have any blood vessels. It just runs on anaerobic glycolysis, means it runs on burning glucose without oxygen. So what happens is when you get atherosclerosis, here's another aorta, you form a lot of these orange things are calcifications. You'll calcify the posterior wall of the aorta, and that'll bulge into the lumbar artery, and it'll become stenosed, narrowed, or occluded. Then you drop the oxygen supply to the spine. When you drop the oxygen supply to the spine, you compromise the disc. It doesn't get enough oxygen. It has an outer circular layer like a steel belted radial tire, and then in the center, it's soft like a jelly donut. That's called the nucleus pulposus. The outer part is called the annulus fibrosus. So when the annulus fibrosus doesn't get enough blood to get its glucose in particular, it starts to crack. And when it cracks, and then the nucleus pulposus can leak out, herniate the disc, and the disc will dry out, desiccate, we often say medically in reports, and it'll lose its height. Okay, so when that happens, then you'll start to get abnormal motion between the vertebrae. That's called segmental instability. Well, the spine has an important job to protect the spinal cord and the nerve roots. So as soon as it starts seeing segmental instability, it gets nervous. It says, uh-oh. And the spine, it's like the old saying, I think it was Ralph Waldo Emerson, the spine is only one trick. He's talking about the hedgehog. He said, it's only one trick, but it's the best trick. Okay. All the spine can do is lay down calcification that forms bone. So it'll form these bridging bone spurs. We call them osteophytes to fuse those two vertebrae together. But what happens is as soon as you fuse two vertebrae together, the vertebra just above them now has to bear more weight and more strain. So it will fail rapidly. We call that an accelerated adjacent segment degeneration. And this process repeats itself all the way up from the pelvis up to the skull. And you form the bone spurs in front are called bridging osteophytes, and the disease is called DISH, diffuse idiopathic skeletal hyperostosis, Forestier's disease. Okay, you get interbody fusion between the vertebral body. You get the posterior longitudinal ligament runs right posterior to the vertebra. It's called ossification of posterior longitudinal ligament. You'll ossify the ligamentum flavum, ossification of ligamentum flavum. You'll ossify the interspinous ligament. It's called Bostrup's disease. The point I'm saying is it's all the same problem due to a lack of blood flow, due to atherosclerosis, due to these high-fat diets plugging up the arteries. There's two toxins that'll do it. There's a couple toxins. Fluoride can damage this as well. We might have a little time to come to that later. And then also glyphosate can do this to some extent as well by substituting for glycine. I'll show what that means in a little bit later. Okay, and then epidemiology. You know, the people in Kenya where they ate a plant-based diet, they did a study here. This is something important. If you've got a little print screen button on your computer, you might want to save this one. You're going to remember this the rest of your life. Blood pressure in the African native, okay, from 1929, Lancet is a journal. Author's name is Donison. 1,800 consecutive adult admissions to a hospital. They checked their blood pressure. In the United States of America, if you check the blood pressure of 1,800 black adults, what percent do you think would be hypertensive? Probably about 80%. Okay. What percent were hypertensive in Kenya? 0, none, not a single one. So all that stuff about genetic hypertension due to salt sensitivity, it's all nonsense. If you eat a plant-based diet, low-fat plant-based diet, you don't get hypertension, okay? 0 in 1,800 patients. And then they also checked average age of 60 years of age. So they took a bunch of men from about, in the ballpark age about, 40 to 70 or so, and checked their average blood pressure. The men from Europe tended to be hypertensive. They're eating high-fat diets. They tend to have a blood pressure about 140/90. The average man from Kenya, 60 years of age, had a blood pressure 105/67. That's a very low blood pressure, okay? And they're fine because they ate a plant-based diet, okay? And it's the same everywhere. If you look at Finland, the Karelia Project in the 1970s, 1980s with Pekka Puska, the Finlands were all fat and sick with plugged up arteries. He put them on more of a plant-based diet. He also did a few other things, got them to quit smoking and to reduce their dietary salt. They had like an 87% drop in cardiovascular mortality. That's incredible. And that's what it is. If you look at the rationing studies during World War I and World War II, when the populations had their meat and their dairy taken away from them, they lost weight and became healthier, even though they were stressed out, of course, during those difficult times. So what I'm trying to say is the diet was more important than the stress. Stress is important for health, but diet's more important. Okay, you can look at the Asian. You get the same old story. The Okinawa is kind of like what Hawaii is to the USA. Okinawa is to Japan. And basically, they're the healthiest of the Japanese. I think it's because they ate a lot less sodium than the rest of Japan. They ate a lot of rice. Okinawans ate lots and lots of sweet potatoes. They had some of the longest lived people in the world. Also, the Seventh-day Adventists around Los Angeles and Loma Linda traditionally had very long lives. The ones who were vegans especially. But the Seventh-day Adventist data is a little bit confusing because I think the nut industry funded some of that. And so you get this exaggerated so-called benefits of nuts, which is a high-fat food. I'm not a big fan of nuts. Okay, anyways, Papua New Guinea also were pretty fit, strong, active guys, other than the fact they smoke like chimneys. Same thing that messed up a lot of the health of the Japanese people. smoking like chimneys, and they put way too much salt on their food, like 12 to 14 grams a day. But the point I'm saying, despite all that, they still were pretty healthy because they're eating a low-fat, plant-based diet. Okay, sweet potatoes are probably the healthiest food in the whole world. Only 1% of calories from fat. Only 4.5% of calories from protein. So less than 5% of calories from protein. The rest is all carbohydrate. China before 1970, some will say before 1980, when they ate primarily white rice. White rice has only 1% of calories from fat. It makes people skinny. The lower the percentage of calories from fat, the skinnier you are. Sweet potatoes, white rice, and regular potatoes all have only 1% of calories from fat. They make people skinny. Okay, here's sort of two major patterns of atherosclerosis. There's a typical Westerner, typical American. They have especially coronary artery disease, plug up the arteries in their heart, die of a heart attack. Most common cause of death in a Western society is to die from a heart attack. They also get a significant amount of carotid disease. The unique thing about the Asians who ate the rice-based diet, like Japanese in the 1960s and 70s, was they get a lot of intracranial atherosclerosis because they're hypertensive from eating tons of sodium. The average American, let's say they're eating about 5,000 milligrams a day of sodium. They were eating 12,000, 12 to 14. So they were eating tons of sodium. They're also smoking like chimney, which is a vasoconstrictor stimulant, and so that also caused a lot of hypertension. So they get intracranial atherosclerosis with a lot of strokes. Okay, so then I now say, I'm going to be going back and forth some of the Greek mythology here, and here was Prometheus. Prometheus loved the humans. He had helped to make the humans, the mortals, and he wanted to help them. And Zeus took fire away from them, didn't want them to have fire because he didn't ever want the mortals to challenge the gods. But Prometheus felt that it was only right that the mortals should have fire. He stole it from Zeus. And so I'm giving you the fire of health. The medical system doesn't want you to know what I'm telling you. Here's your best chance to stay healthy. Low fat, low sodium, 100% vegan, 100% whole food, 100% organic, no oil, no caffeine, no alcohol. That's the big secret of health, okay? That is the fire, so to speak, of health. Here's a couple reasons why. You can look at caloric density. All oils have 9 calories per gram. That's the highest possible caloric density is fat. They're terrible. They're all really bad for health. Olive oil is bad for your health. I do not recommend omega-3s, any of that stuff, okay? I'm just letting you know they're all pure liquid fat, and there's a lot of problems that go with that. Okay, the next thing is stuff like meat and cheese and some sweets. Now you're in the ballpark of about 4 calories per gram. Especially the meats are bad. There's a whole bunch of reasons why. The animal protein in meat is a problem. The fat in meat is a problem. Simple sugars are a complex subject. Some athletes can do well with them, but a regular person who's not exercising that much would be best not to be, eating too much simple sugar. We're not going to get into all that, but it does matter how active you are. Okay, next thing is your basic grains, like your oats, whole grains, beans, rice, all this stuff. It's in the ballpark of 1 calorie per gram, okay? Because there's lots of fiber. So even though it's primarily complex carbohydrates, there's lots of fiber. So a starch is a complex carbohydrate. Usually we just call it a starch. What that means is the polymer of glucose, a big molecule of glucose wrapped in fiber. And it takes time for the gut enzymes to peel that fiber off before the glucose is absorbed. And that, excuse me, that creates the effect of a slow release energy pill. You satisfy your hunger with the fewest number of calories. That's what you want. It's the best food, okay? The starches and the fruits, but especially the starches. Okay, the next thing is the greens. Now, greens have the lowest caloric density, the vegetables, and it's good to eat more greens if you're trying to lose weight because this low caloric density stretches your stomach and gives you that early satisfaction of hunger. But you can't eat on greens alone. They just don't have enough calories. You will not be able to satisfy your hunger. Okay, now here's what I was talking about with the starch. Because it's low caloric density, it stretches your stomach, and that gives you early satisfaction of hunger. Then it goes into your small bowel here, and it takes time for the enzymes to peel the glucose away from the fiber. So you get this nice slow rise in blood glucose, and it stays normal a prolonged amount of time. Excuse me, if you have simple sugars, there's a tendency for a lot of people, they spike their blood glucose level. The pancreas overcompensates, releases insulin too rapidly, and your blood glucose level comes down too rapidly. It's called rebound hypoglycemia. When it drops here, you feel lousy and you want to go run and eat something sweet. Okay, your basic starches are things like potatoes, sweet potatoes, rice, quinoa, oatmeal, peas, lentils, garbanzo beans, that sort of stuff. Okay, sort of the classic book on understanding starches is The Starch Solution by John McDougall. John McDougall is widely considered the greatest doctor who ever lived. And here's some quotes by Dr. McDougall. The fat you eat is the fat you wear. The biggest toxin in the Western diet is the fat. You ask me what is the answer to your health problems, and I will tell you it is starch. Starch is the solution. That's why I call this book Starch Solution. Starch has unlocked the door to good health for thousands of my patients. Healthy populations get most of their calories from starch. In fact, that's all long-term, large, healthy populations get most of their calories from starch. There are no exceptions. There is no fruitarian population, large fruitarian population in the world. 99% of people, 99.9% of people, you might even have said 99.99% of people who have walked this earth have eaten starch-based diets. The same truth dates back through recorded human history. Asians have been eating rice for over 10,000 years. Okinawans also ate sweet potatoes. The Mayans and the Aztecs were known as the people of the corn. The Incas of South America ate potatoes and quinoa. The ancient Egyptians ate wheat. In Africa, they ate millet and sorghum for 6,000 years. Okay, so all healthy big populations are starch-based. When you eat high-fat diets, you get higher LDL cholesterol. The higher the LDL cholesterol, the thicker your blood becomes. That's called blood viscosity. And what that's about is your red cells have a negative charge on their outer surface. It's called a zeta potential. And a bridging molecule is something with a positive charge that can overcome the zeta potential. The reason your red cells have a negative charge on their outer surface is so they repel each other. And by repelling each other, they don't stick together. That's what you want. So they don't clot. The main reason people die is because of blood clots. A clot in your heart is a heart attack. A clot in your brain is a stroke. A clot in one of your other organ systems can drop the oxygen to the tissue, and that can injure the mitochondria and lead to cancer. That's called the Warburg effect. So blood clots are the main thing that kills people. So that's why you don't want unnecessary blood clotting. Okay, these are some things that will stick these red blood cells together. High LDL cholesterol from these high-fat diets. Fibrinogen, when it's activated, a blood clotting protein. We're going to talk about how that gets activated. Psychological stress increases activation of fibrinogen. Okay, IgM antibodies. That's why an acute severe infection can cause significant blood clotting. Uric acid, which you get from eating a lot of meats and also from eating high fructose corn syrup. Okay, so when it sticks the red blood cells together, they make the blood thicker. So normally, why do you have a blood pressure? So you can pump blood to the top of your brain where your cerebral cortex is. You have to pump that blood against gravity. Normal blood is like water, so it's relatively easy to pump water. But when you're pumping thick blood, pressure has to go up to pump that thick blood to get it to the top of your brain. In addition, when you eat salt, it constricts the arteries, makes them narrow. So now you're pumping, let's say you eat a high-fat, high-sodium meal, like a pizza, okay? Now you're pumping thick blood through narrowed arteries. Pressure has to go up, okay? They've looked at the arteries. They can watch these arteries in real time after feeding patients high-fat meals, high-sodium meals. And, Dr. Swank, Roy Swank, he measured the blood flow, the oxygen delivery to the brain in a hamster, for example, after a high-fat meal, and it dropped by 30%. Peter Quo showed that in other contexts, dropping to 15 to 20%. Okay, and a lot of people have done different variants on this type of study in the eyes, in brains, and open surgical sites, and the sublingual arteries beneath the tongue. Peter Quo was a cardiologist in Pennsylvania back in the 1950s, and he fed people a high-fat meal, checked their blood fat levels every 30 minutes, and he correlated that with their chest pain. These were cardiac angina patients with coronary artery disease, and they tended to get most of their chest pain when the lipids were highest in the blood. Okay, and it didn't matter if it was sat fat or any of the omega-6 cooking oils. They all had this effect. David Blankenhorn did a bunch of studies. Whatever fat you eat, they all increase atherosclerosis. That includes olive oil, the MUFAs, monounsaturated fatty acids. It includes the PUFAs, polyunsaturated fatty acids, like omega-6, omega-3. It includes saturated fat. They're all bad for atherosclerosis. Okay, they all go right into your tissues. Here's one of the papers. This is by Meyer Friedman and Ray Rosenman. Okay. And they found this conclusion, when they fed the patients the high-fat diets, they saw it plugging up the arteries in the eyeballs. They used an 80-fold microscope to look over the eyeballs, and they saw all these arteries getting plugged up. It's a transient thing initially, but you keep on doing that all the time on a daily basis, you'll start occluding those small arteries. Okay, so what happens with high blood pressure? When the blood pressure comes up at a high pressure, it has a higher peak systolic velocity. It hits the median divider. For example, this is the common carotid artery in the neck. Imagine my forearm is the common carotid artery. My thumb is the internal carotid artery going up to the brain. And my fingers are the branches of the face, external carotid. So this is the median divider right here. Okay, it hits the median divider at the arterial bifurcation, and it bounces off of that. and you get some turbulent flow. You also get retrograde eddy currents. The higher the pressure, the more turbulent flow, the more retrograde eddy currents. When these are excessive, they activate the platelets, make them prone to clotting. It confuses the lining cells of the artery, the endothelial cells, and they start to release their antithrombotic glycocalyx, and they start to express prothrombotic molecules on their cell surface, like say VCAM, vascular cell adhesion molecule, for example. And the blood will start to clot and stick there. I looked at many, many thousands of these things. This is right where you see a clot. Another important point to understand is atherosclerosis is a blood clot. You need to know that. Atherosclerosis is a blood clot. Once you understand that, when you read about atherosclerosis, things will make sense for you, okay? And what I'm trying to say is people think, oh, the cardiologists are such great experts at the heart. No, they're not. Treatment of coronary artery disease with pills doesn't really do much for increasing longevity. Treatment with stents is like a 0% increase in longevity for chronic angina. You know, it can save your life in the middle of a heart attack, but for most patients are chronic cardiac angina patients. Open heart surgery for chronic cardiac angina, coronary artery disease, atherosclerosis has a 0% increase in longevity, okay? What's the cure rate for low-fat vegan diet with no oil, the Esselstyn diet? It's close to 100%. It's at least like 99%, okay? And that's what I joke, you know. How is this better than a witch doctor? How is this better than Bozo the Clown, okay? It's nonsense. Do you remember Dante's Divine Comedy when Virgil and Dante found themselves at the gates of hell, and there was a sign written above there that said, "Abandon hope, all ye who enter." So the cure rate for conventional medications for treatment of coronary artery disease is 0%. Zero. They never cure it. Cure rate of hypertension, 0%. They never cure it. Cure rate of diabetes, it's 0%. They never cure it, okay? And that's typical for chronic diseases. Can you imagine a bunch of cheerleaders talking about their team? We're the best. We lose every game. We always lose. We're the best. You would say that's nonsense. Well, that's the state of conventional medicine for treatment of chronic disease. It's ridiculous. It's a joke. It's such a joke, it's not even funny, but that's what it is. Okay, here's Prevent and Reverse Heart Disease. This is the best book ever written on how to prevent heart disease, coronary artery disease, atherosclerosis in the arteries of the heart. Here's the author, Caldwell Esselstyn. And, you know, you don't need to buy any of these books. You can just go on the internet and watch their videos, okay? You can watch his videos very easily, and you will see he puts people on a low-fat, low-sodium vegan diet with no oil. And the main thing he emphasizes is that by eating this way, you increase the endothelial cell. Endothelial cells are the cells that line your arteries. And the big thing that they do is they produce nitric oxide. So this type of healthy diet, the Esselstyn diet, which is just another version of the low-fat vegan diet, it's low-fat vegan diet, it's where it's at. You can call it the Esselstyn diet, you can call it the McDougall diet, you can call it the Rogers diet, and I call my version of it the Spartan vegan diet. It's all just about the same thing. There's minimal differences between these, but that's the gist of it. Okay, anyways, what that does is it increases the function of the endothelial cells to make nitric oxide. Nitric oxide is a gas. It diffuses into the artery, into the lumen of the vessel, interacts with the platelets, and it prevents them from clotting. That's good. You don't want clots. Okay, it diffuses into the wall of the artery, and it enters the smooth muscle cells, and it gets them to relax. The smooth muscle cell is circumferential around the artery. So when you relax that, it dilates the artery. So it keeps your arteries open, and it prevents clotting. That's exactly what you want. And that's why Esselstyn has by far, he had 198 patients followed for 4 years, and only one had a cardiovascular event. And he says it's because the patient didn't follow the diet, but he included it in the study anyways. He says that of patients who actually follow his diet, the incidence of cardiovascular events is 0, okay? There's nothing like that in the world. There's nothing even that's more than 30 times better than anything else. This is the only diet proven to reverse heart disease. And like, you know, it's been said, you know, since heart disease is the main thing that kills people, you got a diet that reverses it, prevents it. Why wouldn't you want that diet? It's obvious, okay? And people ask, well, are you sure coronary artery disease can be reversed? It can be partially reversed, okay? You're never going to be 18 years old again, but you can reabsorb the acute plaque of the red blood cells, okay, and the fibrinogen protein, strapping them all together. You can reabsorb the lipid core, the fat in the atherosclerotic plaque. You can reabsorb the necrotic core in the atherosclerotic plaque. I don't think you're going to reabsorb the calcification. I know there's some people nowadays claiming, you know, vitamin K2 and vitamin D3 can reverse it. I don't know. I've never seen that, and I've seen other papers that say that's not true. So that's something, a work in progress, but I wouldn't count on that. The fibrous tissue, when it's still cellular, you might partially reverse that. The acellular stuff, you're not going to reverse that. So what does that mean? Well, as soon as you just go on the healthy diet, these endothelial cells that line your arteries will start making more nitric oxide. So you'll get an immediate benefit just within a few days. And then over time, the plaque will shrink some more. So You can get a big benefit. Nathan Pritikin, for example, had, terrible EKG and very poor exercise tolerance, but he went on a plant-based diet and, couple, like a decade later, the guy's, running long distances with tremendous energy. So not everybody improves that much, but you can improve a lot. And some patients will even reverse cardiac cath findings. But it depends, like I said, if it's calcified and acellular fibrous tissue, you're not going to reverse that. Okay, now here's what I call the five.
Dr. Rogers, we have about 15 minutes left, so I just wanted to give you a heads up. And if people had some questions, they could type them in the Q&A and we could try to read those in the last 5 minutes. Thank you.
Yeah, I'll have to go a little faster then. Okay, this is the 5 wounds of the village idiot from getting an open heart surgery. I'm just joking there. And then people always tell me they don't have any time to read. I'm like, well, take a look at my bathroom, okay? I have a little table. You can move it with your foot in front of the loo. You can read a book right there. You put one on the table, read one during number ones, during number twos. You got time to read. I read at least one book a week that way. I always listen to an audiobook in the car. Minimum 2 weeks. I get 2 books I get through every week. Okay, chronic hypertension damages the thoracic aorta. You lose elastic fibers. And then when you lose those elastic fibers, you don't get diastolic flow, so you're going to be hypertensive for life. That's why you want to reverse it. The sooner the better before you lose all the elastic fibers in your aorta. Walter Kempner was reversing people's blood pressures in the 200s with a low-fat vegan diet, primarily a rice and fruit diet. It's good to not add extra salt to your food. A little bit on the outer surface of your food is not a big deal, but you definitely want to eat a lot of plants. That's where potassium comes from. P for potassium, P for plants. Sodium is high in the processed food because that helps prevent hypertension. Okay, your body has a fixed amount of the two, and the more sodium you eat, the more you lose potassium. Potassium is a vasodilator. Sodium is a vasoconstrictor. So just eat your plant foods. So this just goes to show if you eat the American diet, real high fat, you're going to have health problems. Okay, East Asian diet was a lot better, the rice and the vegetables, but they smoke too much and too much salt. The problem that gets people in trouble who eat like Indian food, India diet, is they fry too much food. Okay, there's a lot of good plants in there. They also eat some yogurt and stuff, the ghee. You eat the low-fat vegan, you're better at all diseases. You get much, 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 much less diabetes, hypertension, heart attack, stroke, impotence, and cancer. It's like, why wouldn't you want that? It's like winning the jackpot at Vegas. Why wouldn't you want that? Okay, we kind of talked about these curves. High-fat diets cause insulin resistance, leading to diabetes. That's another problem with the high-fat diets. This is just showing the insulin receptor. It's going to be inhibited by high-fat diets. It's an indirect effect because they inhibit mitochondria. The mitochondria is overwhelmed. It sends a signal to the cytoplasm saying, do not allow any more energy into the cell, no more glucose into the cell. And that's why they get high blood sugar and diabetes. That's the mechanism. The main mechanism of insulin resistance is due to high-fat diets inhibiting mitochondria. Okay, it's called overnutrition. Okay, and you can't stop it. The more fat you eat, the more it gets into the cell. There's something called the fatty acid flip-flop maneuver, whereby it can get itself protonated, intercalate into the outer leaflet of the plasma membrane, flip into the inner leaflet, move into the cytoplasm. So you can't stop this other than to eat less fat. That's the only way to win. And you'll initially concentrate fat in your skeletal muscle, getting postprandial after eating hyperglycemia. It'll then concentrate in the liver. You get fatty liver. And now you can't regulate blood glucose level while fasting. You get fasting hyperglycemia. The pancreas fails, becomes replaced by fatty atrophy, and you get all the complications of diabetes. Terrible disease, okay? Not to mention cognitive decline. And what do you got to do? Just eat less fat, and your body weight will optimize. Your fatty liver will resolve. First place where you lose the fat from is the liver. And, for example, Roy Taylor, he cured all his diabetic patients that had diabetes 4 years or less because they still had intact pancreas. Once the pancreas is gone, you lose your insulin, and you're stuck. You're going to have to take insulin, but most people, type 2 diabetics, they can all be reversed initially. Okay. You want to exercise. This is the sea squirt. In its juvenile phase, it swims around like a tadpole. It has a brain. Adult phase, it attaches to a rock, becomes a filter feeder, and then its brain is completely reabsorbed, recycled. You don't need a brain if you just sit around all the time. So a lot of humans are like that too. They just become couch potatoes as they get older. Their brain partially, it shrinks. Okay. You got to exercise. It uses your brain. Chronic diabetes and hypertension, it thickens the wall of the arteries. The yellow part here, the basement membrane, and you get hypertrophy of the vascular smooth muscle cells. That makes it harder to send oxygen to your tissue. So here's the red cells going through a capillary. The blue circles are the oxygen. Here's the neuron, your brain cell. And you have to deliver oxygen to the cell. The more you thicken this capillary basement membrane and get muscular hypertrophy, the less oxygen you can deliver to your tissues. And diabetes and hypertension cause these problems. So the longer you have these diseases, the more likely you're going to compromise blood flow to your brain cells and decrease your cognitive function. Jack Delatorre did experiments where he tied off the carotid artery in the neck of a mouse And what he found was middle-aged and older mice, you tie off that artery, the same side of the brain, within about 2 months later, it shrinks, it becomes atrophied, and they get cognitively impaired, demented. So this is called the vascular hypothesis of dementia. And he did lots of variations on it, tied both carotids, tried the verts in the back. And that's what he always got. And at first thought, you're going to say, how many people have internal carotid artery occlusions? Not that many. Yeah, true. But a lot of people have overtreated hypertension, global cerebral hypoperfusion. They overtreat it. If they don't treat it at all and it's bad, then it damages the arteries like I just spoke about, diabetes as well. People got sleep apnea, they're hypoxic, they're not breathing adequately at night. Aortic stenosis, aortic regurgitation, atrial fibrillation, congestive heart failure, all of these things will drop blood flow to the brain and increase your risk of becoming demented. And you want to really sort of have a happy median. Remember Aristotle's golden mean? You need enough blood supply going to the brain, but not more than you're supposed to have. Okay, so what am I trying to say? If hypertension is really bad, untreated, let's say systolic's over 170, you'll have a tendency to injure these lenticulostriate arteries that go into the bottom of the brain, the basal ganglia, and you get little strokes in these areas. Okay. On the other hand, what I see much more often is people have inadequate blood supply over the top of the brain, and they then have these penetrating arteries that don't have good collateral flow, and they get these little strokes. These are the cerebral ventricles, so we call these periventricular. I see periventricular strokes here every day, like hundreds of them. Okay. This is the most common spot for people to get strokes. And these are cortex where they don't necessarily have a full muscular deficit, unilateral hemiplegia, but they're progressively cognitively impaired. And it's very common in dementia. That's a picture of me when I was younger. Here's one of my books I wrote, Food, Mood, and IQ, 100 ways to be happier and smarter. This is the best book ever written about the brain. I explain why people get diabetes, hypertension. It's a little more advanced than McDougall's book and Caldwell Estenson's book. I wanted to explain to people, this is what causes dementia. There's a whole bunch of these things contributing to it, like these mitochondrial inhibitors, and this is what you can do. If you're walking down the street and you see a car coming, you get out of the way. But if the car is invisible, how do you get out of the way? So what I did in a sense was I made the car visible. I said, these are the things inhibiting your mitochondria. These are the things that cause atherosclerosis. This is what causes hypertension. This is what causes diabetes. Just avoid these things. And to me, it's very empowering because you can avoid these things. Now that you know, why not do that? To some extent, life's a little bit like a video game, Super Mario Brothers. You're going through an obstacle course. You do the good things, you get little energy points, the green things, the green lights. You do bad things, you screw up, you get the red points. It takes away your energy. So that's the same thing for your health. Do the good stuff, get your sleep, eat the healthy diet, manage your stress, and you get energy points. And avoid the bad stuff. No tobacco, no alcohol, no high-fat foods, no animal foods, no oils. And you'll be a lot healthier. If you don't have dietary fiber, you become constipated. Dietary fiber pulls water into the stool, makes it more bulky. It stretches your rectum, so when you defecate, it just comes out by a reflex maneuver automatically. Okay, if you're constipated, you don't eat enough fiber, then you have to push a little bit with your abdominal muscle. That's called a Valsalva maneuver. And that pushing down increases intra-abdominal pressure. That back pressure causes problems. It pushes up into the sigmoid colon, causing diverticulosis, can lead to diverticulitis, a perforation of the colon. The dried out stool on the right side can block the appendix. You get appendicle lifts, and that can cause appendicitis. The pressure goes down into the legs, can cause varicose veins. Down into the scrotum can cause a varicocele, big dilated vein, heats up the testes, can make you infertile. Pushes down into the rectum, rectal hemorrhoids. Pushes up on the stomach. Stomach goes into the chest, hiatal hernia. Then you get acid reflux in there, gastroesophageal reflux disease, GERD, which can progress to cancer eventually. All of that stuff's bad. So you want to eat your fiber. It just means plant foods. There's no fiber in animal foods, and there's very little in processed food. All plant foods have it. It's the cell wall. Okay. When you eat the good foods, you get good gut bacteria. When you eat the non-fiber processed foods and animal foods, you get bad gut bacteria, and they deconjugate the estrogen that our body normally excretes into the bile. What this means is if you don't eat enough plant foods, you become estrogen overloaded, and that increases your risk of breast cancer, fibroid tumors of the uterus, okay, and increases your risk of obesity. Estrogen is a fat storage hormone. And you got a lot of these guys who get estrogenic effects from drinking a lot of beer, and they think, oh, I got a beer belly. And I'm like, no, you look like a pregnant female, okay? Big belly, they get moobs, man boobs, okay? Gynecomastia, you don't want that, okay? This is leaky gut, meaning that normally dietary fiber is ingested by the good bacteria. They convert it into short-chain fatty acids. The most important one is butyrate, 4-carbon butyrate. Okay, that butyrate is taken up by the gut lining cells called enterocytes, because the gut's the enteric tract, and they form tight junctions. The tight junctions prevent bad stuff from getting across the gut lining. If you don't have enough dietary fiber, then you don't make your tight junctions, and bacterial toxins can get across there, like LPS, lipopolysaccharide, okay? LPS, LTA for gram-positive bacteria, lipoteichoic acid, and these will cause a problem to the immune system. The immune system senses the bacterial toxin as a bacterial invasion, and the immune system starts to hyperreact, even overreact. That'll cause inflammation of the gut, irritable bowel syndrome, Crohn's disease, ulcerative colitis. Okay, these are a whole bunch of chemicals that are toxic to the gut lining. It includes alcohol. It includes non-organic corn, the non-organic soy, glyphosate, okay, soda pop, the fluoride, the aluminum, okay, the mercury that's common in high fructose corn syrup, and a whole bunch of other chemicals, the emulsifiers and processed foods. All of these things damage your gut. Caffeine, okay, the dairy, you don't want them, all right. It also increases the tendency of the blood to clot through a mechanism called amyloid clotting. We don't have time to go into that right now, but you don't want it. And that free iron I spoke of earlier, that also causes more blood clotting. It predisposes your blood to clotting. So my recommendation is what I call the Spartan vegan diet, because it's simple, it's sparse, and from my background, I used to being a wrestler, I kind of get teased. I came up with this name, the Spartan vegan diet. Real simple. Do the social stuff we talked about that makes you healthier. Eat the majority of your calories from starches. McDougall would recommend 90% of calories from starches, 5% from fruits, 5% from veggies. I actually eat about 60% from starches, 35% from fruits, and 5% from veggies. I'm pretty active. Okay. I exercise a lot, so I think I can do that. Okay. It's been working out well for me. But if you don't exercise that much, then you should eat less fruits. Okay. Because there's a tendency to overeat fruits. They taste so good and they don't satisfy hunger quite as quickly as starches do. But this is it, Spartan vegan diet. And that's like pretty much the secret of health. So that's basically it.
Excellent presentation. You sure packed a lot in there. We have some biology background people that were blown away with your knowledge of chemistry, etc. And I directed them to your YouTube page, which is Peter Rogers, MD. So the one question we had in the few minutes we have left is regarding vitamin B12. Please comment on the necessity of vegans to take B12.
If you're 100% vegan, you're eventually probably going to become low in vitamin B12. So it's good to supplement it. What I would supplement it with is something like methylcobalamin, the one with the fewest number of ingredients. And I take it about like once every 2 weeks. I take a couple little tablets of it. People will be different in their dosages, like 5,000 micrograms. I'll probably take about 10,000 micrograms every 2 weeks. That's enough for me. And then I check it, so I know my levels are always good. And the first couple of years, you probably won't even need to take it. But that's the one thing you have to be careful about with the vegan diet. And it's because it comes from the soil bacteria. Okay, it doesn't come from the animal, but the animals have it in their body. So that's the one thing you get from the animal food diet, though, that you don't get from the vegan diet.
Yeah, I'll try to combine these two. What do you think of the emphasis on eating proteins? Do we need 100 grams of protein a day?
Oh, I think that's a whole bunch of nonsense. Okay, the reason I say that is Dr. Kempner was feeding his patients about 4% of calories from protein. They did just fine with that. Okay. There's also something called the Golden Study, where they had a bunch of people who were starving, and they then, fed them different types of diets to bring them back to health. And the patients who were fed 2.5% of calories from protein did very well. I would say it's impossible. Dr. McDougall and Nathan Pritikin would agree with this after extensive study of the literature. It's impossible to be too low in protein with any naturally chosen diet. The typical plant-based vegan diet has you end up about 80-10-10. 80% of calories from carbohydrate, 10% from protein, 10% from fats. Okay, so the recommended daily allowance is like 0.8 grams of protein per kilogram per day. And there's a pretty famous guy out at Stanford. His name is Christopher Gardner, and he's got some pretty good lectures on protein. He's going to tell you the recommended daily allowance is designed to have a safety margin in there, and it's too much protein for over 97% of the population. Okay, and there's a lot of work that's been done on low protein diets for kidney failure patients. And you can get by with quite lower levels of protein. And you especially want to avoid animal protein, because animal protein has more methionine, for example, and leucine. These are things that activate mTOR, which is a growth pathway which gets cells to replicate more quickly. You only get about 60, 70 cell replications before cells tend to die, your non-stem cells. So what I'm saying is The meat diets accelerate the replication. You're reaching the Hayflick limit where the cells die. Okay. In animal studies, low protein diets cause increased longevity. Caloric restriction also causes increased longevity, but that means starvation. Nobody wants that. But protein restriction is easy. You just eat low protein food. You automatically protein restrict without having to change your calorie intake, and you feel good. That's the smart way to go. That's what I do. James Mitchell has lectured on other reasons why that's beneficial. We don't necessarily have time right now, but that's the best play you can make for optimal aging.
We have 2 questions left. Did you want to stick around for the last 2 questions? Why is caffeine bad? And then what about diet for people with chronic nerve pain because of like a bad car accident?
Okay, let me just one last thing on protein was, breast milk only has about 5 or 6% of calories from protein at your most rapid phase of growth. You're not growing that fast the rest of your life. You don't need that much protein. So I'm just letting you know this whole thing about protein, needing more protein, is all exaggerated. All right, and it gets people to have bad eating habits. Okay, the next question though was caffeine. All right. And the thing about caffeine is caffeine's part of the stress response in the sense that it increases catecholamines, adrenaline, noradrenaline, and cortisol. Those are the stress response hormones. In stress, the mnemonic is being chased by a tiger in the dark. You just need to survive the next 30 minutes. You're being chased by a tiger, climb a tree, whatever you got to do. So it kind of shuts down blood flow to the frontal lobes and a bit to the hippocampus, the sort of contemplative thinking areas. It's more of, you'll still have blood supply to your cerebellum for a quick response. But what I'm trying to say is it drops blood supply to your frontal lobes in the ballpark of 25%. You don't want that. While simultaneously, it causes increased glutamate release at your synapses. The cortisol does that. So it increases the metabolic rate of the neurons. This is part of my metabolic theory of neurodegeneration. You're increasing the metabolic rate of the neuron while simultaneously dropping the blood flow. That's a no-no. You don't want to do that. Now, you can handle there's some play and reserve in the system, but you don't want to start stacking the deck against your brain cells, pushing you towards dementia, okay? Caffeine is a vasoconstrictor. It increases your blood pressure. Because it elevates cortisol and catecholamines, it increases your blood lipids, increasing your risk of atherosclerosis. It increases the clotting factors in your blood a little bit. It increases your tendency to urinate and void out your potassium, your good stuff, your vasodilators. So it pushes you in a bad direction. You don't want that. For good, quick stress response, fine. If you're tired and you have to drive home and you're sleepy, you can justify it in that context. You can justify it in the context of athletic performance, in a short interval. But in terms of like a daily habit, it's a bad habit. The older you get, the more fragile you get. And so you want to avoid these bad habits. Dropping blood flow while increasing neuron metabolic rate is not a smart move.
And real quick, any diet for people who've had an injury from like a car accident, that have nerve problems?
Okay, well, I would give you what I would call my holistic philosophy of disease. Your body always wants to heal. Your body's always trying to heal. So the smart thing to do is give it what it needs and get out of the way. What I mean by that is everything in your body works better with good blood flow. So what gives you good blood flow? A low-fat, low-sodium, plant-based diet. So that's good. That's what you want to do. If you have a major tissue damage, that is a special setting where you would want more protein. So if you have major injury with extensive healing that has to occur, in that setting, you would want more protein. But that's about the only one, okay? But you want good blood flow to the tissue, and you also want the immune system to work well. The immune system becomes dysfunctional with sleep deprivation, with caffeine, with fat diets, with high sodium. All of those things have a negative effect on immune function, so you want to avoid them. And you have to be careful. You'd want to avoid all these mitochondrial inhibitors. Your immune system needs lots of energy to run around and fix things. In particular, your immune system, when it's deep in the pocket of a wound, there's not good oxygen there, so it has to run on anaerobic processes, okay? You don't want to damage the mitochondria, and you want to avoid the fat. All of those things will give you better healing. A famous lady is by the name of Ruth Heydrich. She had breast cancer, became a low-fat vegan, marathoner, triathlete. She was about 70 years of age. She got hit by a car riding her bicycle, training for a triathlon. She had a comminuted lower extremity bone fracture, meaning shattered into multiple pieces. They told her she'd never walk again. She would eat these giant bowls of salad, 2 big bowls of salad a day with the rest of her low-fat vegan diet. And she was up and running again in a couple of months. Okay, I give you that as an example. Yeah, you hear stories about old people. They fall, they break their hip. A third of them die. Okay, but this lady's up and running again after a really terrible fracture. You get better healing in that way. So that was my point. good healing, and stay out of the way of your immune system.
Just a fantastic presentation, Dr. Rogers. We're so grateful that you came here. I want to remind everybody about his book, Mood, Food, and IQ. And you can see him on his YouTube channel, Peter Rogers, MD. Thank you so much.